Howdy, my name is Daniela Zapata, and I chose the movie The Soloist for my clinical case presentation. The character I chose from the movie, his name is Nathaniel Ayers. Nathaniel Ayers Jr. is first presented as a homeless man living in the streets of Los Angeles. He is first introduced to us by playing the violin in the street. As we get to know him throughout the film, we discover he is a talented Juilliard musician who has fallen off the rails due to his mental disorder. The movie switches from the past and to the present to depict the current reason for his mental state. I believe that he has schizophrenia. Schizophrenia is a mental disorder that falls into the schizophrenia spectrum and other psychotic disorders in the DSM-5. It is characterized as a disorder that can affect the way a person thinks, behaves, and feels, as well as cloud one's judgment from what is real versus what is fantasy. Schizophrenia is known to occur during adolescence or early adulthood. The main prevalent symptom that I saw in Nathaniel was his disorganized speech. Disorganized speech is ongoing, disjointed, or rambling monologues. Throughout the whole movie, he does this, making this his most defining symptom. The first representation of disorganized speech is through Nathaniel's first interaction with Steve. When he is asked by Steve if he likes Stevie Wonder, which is written on his shirt and his visor, Nathaniel begins answering the question and then changing the topic, going on a rant with rapid speech, which is difficult for Steve to interrupt. His second most prevalent symptom was hallucinations. Hallucinations are a perception of having seen, heard, touched, tasted, or smelled something that wasn't actually there. Throughout the film, Nathaniel is seen to suffer from auditory hallucinations, hearing voices in his head. This is first seen while he is in class at Juilliard. It's brief, but allows for an introduction into his auditory hallucinations and the start of his symptom. Then, while he is at symphony rehearsal, he is unable to play due to the voices whispering in his head. His illusions at first are only shown in the past, until Steve plans a mini concert for him. In this scene, we see him starting to hallucinate voices in his head. At first laughing, then telling him, "You never have been here, you're not here, Nathaniel." Delusions are false beliefs strongly held in spite of invalidating evidence. Nathaniel seems to present all 5 of the main symptoms of schizophrenia, but delusions is only really represented once, when he believes his sister is out to get her and has put hydrochloric acid in his food. Other than that scene, the movie seems to emphasize his disorganized speech, hallucinations, catatonic behavior, and negative symptoms more than his delusions. Treatment from schizophrenia is usually treated by antipsychotics and or physiosocial therapy. Antipsychotics are neuroleptics or major tranquilizers that help reduce psychosis symptoms. Psychosocial refers to a person's interaction with their social environment and is usually treated through structured counseling. For Nathaniel, I believe that he should not be treated with medication because many people with schizophrenia, because they lose touch with reality, deny or refuse the idea that they have this disorder. Nathaniel, towards the end of the film, reads the contract that Steve gives him, and it says that he has a schizophrenic mind. This scene causes him to freak out and attack Steve. It was said earlier in the film through a therapist that sometimes medicated treatment isn't the best option for people like Nathaniel, which is why psychosocial treatment would be the best option, as just his relationship with Steve was seen to help. The symbolism of Nathaniel not shaking Steve's hand in the beginning, but then being able to at the end, shows how he has benefited from just the friendship alone. Schizophrenia, what's it really like? Common misconceptions about schizophrenics that are seen in movies are that they are violent, drink alcohol, or heavily use narcotics. This movie portrays schizophrenia in a thoughtful and precise manner. Delusions, hallucinations, and behaviors are portrayed truthfully through the functional impairment they cause. Additionally, the film illustrates the toll of caring for individuals with schizophrenia. It allows for schizophrenia to be seen more realistically than the stereotype media has on them. That is all. Thank you.